So I'm going to hand it over to Despina, one of our student planning committee members, to get us started. And I will go ahead and get us to our next slide for you. All right.
Thank you so much. So welcome everyone to the Student Showcase. Thank you so much for joining. So if you have any questions, feel free to put them in the chat, and we'll get to them after everyone has gone through their presentations. So first we have Ariana with A Future Beyond Libertad, moving towards justice and U.S.-Cuba policy. So Ariana, if you want to share your screen and start your presentation.
Okay, can you hear me?
We can.
Okay, cool. Sorry, it just had me rejoin as a panelist. And share now. Actually, I don't know if I have the option to share my screen. Oh, no, wait. Okay, I do. Sorry. It's been a while. Okay, can you see like a Canva?
We can.
Okay, sorry, y'all. Technical difficulties. So, yeah, so my policy product is a policy brief called A Future Beyond Libertad, moving towards justice in U.S.-Cuba policy. So for some context, I'm Cuban American, and so this type of policy is very important to me and my family. And so I just wanted to share that with the Graduate Policy Scholars Program, because this is a part of policy that I think people don't think about a lot, but it's very important for a lot of people, especially those who live on the island in Cuba. So last semester in a policy class I was taking, I kind of imagined what changing the current policy towards Cuba would look like. So the act that codified the US embargo that had been established in 1962 was the Libertad Act of 1996. So it became officially our US policy that we had this Cuban embargo until a democratic transition happened in Cuba. But it was very vague in the way it was written. And so I tried to do a brief on this last semester because the island of Cuba faced 3 hurricanes and 2 earthquakes within 2 months. It caused an entire electric system, power failure. The entire island was really struggling. And we still had these restrictionist policies against Cuba that was causing people to not have access to the bare necessities. So for me, that was a really big issue. And so when I was thinking of my policy product for this program, I was really delighted to see that there had been a Senate bill introduced this year called the United States-Cuba Trade Act of 2025, which would repeal the Libertad Act of 1996, and it would work to normalize relations between the two countries. And so it's important to think about the longevity and just the, I guess, how extreme the embargo itself has been. So when I spent a lot of time in Cuba, driving around, you see the billboard that's on the bottom of this brief. And if you don't speak Spanish, it says blockade, which is what they call the embargo, the longest genocide in history. So the people of Cuba feel this and talk about this every day. It is a part of just general life in Cuba. And it makes sense because 80% of Cubans have lived their entire lives under the trade embargo. And it is a low-income country, yet even within a given year, they can lose up to like $4.9 billion. And this is an issue that also causes economic issues for the United States. It's just not something we talk about a lot. And it has caused the conditions that have been created under this embargo have caused over 10% of Cuba's population to leave the island since 2022, which is an unprecedented figure for any country that is not actively at war. So this is a very important issue, like I said before. So the purpose of this brief is to have senators vote in favor of the United States-Cuba Trade Act. And so it would repeal the act I mentioned before. It would stop allowing for presidents to limit remittances, because that's actually happening right now. The Trump administration doesn't want any remittances to be sent for people's family back in Cuba. And additionally, it would allow U.S. citizens and residents to travel to Cuba to buy Cuban goods. And it would allow Cuban Americans to have legal contact with their family members through like telecommunication services. So it's also really great for U.S. Like I guess the way people view the U.S. across the globe. It is globally condemned. So this is also, I guess, a selling point is that it would make the US look better. And then I just also want to drive home that, again, 10% of Cuba has left Cuba in very recent years. And people are crossing the ocean. People are going through Central America to get through the border. And people are dying. And so it's a very important humanitarian issue. And yeah, so that's my policy brief.
Thank you so much for sharing, Ariana. It was really interesting to hear about the work that you've been working on and also your personal connection. It was very interesting. Thank you. So next up, we have Hafisa Noor Ul Ain with extreme weather events and public health preparedness in Missouri. So if you want to go ahead and share your screen.
Hello. Hi, everyone. Um, um,
I think Haviza may be having some internet issues, but we will see if she rejoins here momentarily. Otherwise, we'll just reorder our presentation. Here she is.
I'm really sorry. It won't let me share unless I quit it. So, okay. I hope you guys can see my screen now. Okay. My final policy product is about public health preparedness for extreme weather events in Missouri. And I wanted to write about this because this has been a personal issue for me. I am a Fulbright scholar from Pakistan, and my Fulbright application to come here in the US was mostly informed by my exposure or my country's exposure to climate change and how extreme weather events are connected with public health and how climate resilience has to go hand in hand with public health preparedness. So I based my policy product on how public health preparedness should be a part of climate resilience here in Missouri as well. I wanted to talk about how the billion-dollar disasters or climate extreme weather events have increased in Missouri in the past 10 to 15 years, like they have for various other parts of the world. And I wanted to talk about how Missouri, like other countries who are developing climate resilience, should also focus more on public health preparedness, because these extreme weather events lead to public health disasters, either through death or injury, or through exacerbating any underlying public health problems. We can see in the graphic that the graph shows that billion-dollar disasters have been increasing in Missouri over the past years. I wanted to also talk about the fact that even though there are some policies in place in Missouri to handle the public health disasters that can be caused by natural disasters or extreme weather events, for example, we have the Public Health Emergency Preparedness Cooperative Agreement that is already a key federal funding mechanism for state and local preparedness. But I discussed in the policy product that there has been fluctuating political support for this, which leads to gaps in workforce readiness, emergency response training, and healthcare system coordination. And I also wanted to talk about the fact that the FEMA, or Federal Emergency Management Agency, that exists to assist states in disasters or extreme weather events, it focuses on recovery instead of proactive risk mitigation. And we're talking about public health preparedness, not response. So my policy recommendations were to establish a statewide extreme weather health task force. So this task force could be multi-agency. It could be under the Department of Health and Senior Services in Missouri, and it could include representatives from public health, emergency management, environmental protection, and they would then build a 5-year Missouri climate health resilience plan. And then this plan could assist them in building public health preparedness. And I would also advocate for Missouri to invest more in climate resilience health infrastructure. There are certain high-risk zones, and there are certain high-risk or more vulnerable communities within Missouri who are more vulnerable to extreme weather events or the impacts or health impacts of extreme weather events as compared to other communities. And they should be the focus of our new climate resilient health infrastructure. We also need to expand community-based preparedness programs. We need to train community leaders or community health workers to assist in heat stroke prevention, for example, and for mental health first aid. We also need to enhance data and surveillance systems so that real-time weather data could be integrated with public health surveillance and help in implementing all these policies. These are my consulted sources. And I guess, yeah, that's it. Thank you.
Thank you. That was really interesting. And I really liked how your approach was more of a proactive approach rather than solely a reactive approach. So thank you for sharing. Next, we have Sarah Mendiola, and she's going to be talking about Safe and Inclusive Care Bill of Rights.
So I'm just gonna get my screen up. All right. Can y'all see this? Okay. Cool. All right. Yeah. So, my policy product is it's a 1-pager, 2-pager, front and back, for the Safe and Inclusive Care Bill of Rights, which is an LGBTQ and HIV, long-term care bill of rights for Minnesota. This is something that I worked on as a part of my practicum. So I'm an MSW, MSP dual degree student, and I did my MSP internship and my concentration practicum with SAGE, which is an organization that does advocacy and services for LGBTQ plus older adults. And I worked with their advocacy team on a coalition of LGBTQ plus older adults, people living with HIV, and some community health organizations to advocate for a long-term care bill of rights that specifically focuses on people living with HIV and trans older adults in long-term care facilities. And we ended up with community input, adding home and community-based services into where we hope the Bill of Rights will go. So this is something that is currently being proposed in the Minnesota State Legislature. And yeah, so I'm just gonna go through this one pager with y'all basically. So we start out with a kind of opening statement um, that talks about how LGBTQ plus older adults and people living with HIV have unique care needs. And but they have been historically unsafe and discriminated against in long-term care institutions and the healthcare space, um, which kind of establishes why we need this Bill of Rights. And then it goes into some basic statistics about Minnesotans who are over the age of 50 and LGBTQ plus, and Minnesotans who are living with HIV. Um, from there, we kind of introduce what a long-term care Bill of Rights is. So the idea of a long-term care Bill of Rights is that it ensures anti-discrimination protections for people who are living in long-term care facilities. Um, So this bill specifically would focus on three main areas: expanding legal protections, putting in place cultural sensitivity education for long-term care workers, and then an implementation and enforcement piece. Um, so in terms of legal protections, facilities would be banned from discriminating against residents for HIV status and gender identity. Um, in all stages of the long-term care process, whether that be like intake or discharge or like day-to-day things. The cultural sensitivity education would be something that is required. We're hoping to do a budget ask, get a budget ask in the actual Bill of Rights so that it is funded. But we shall see if that is something that passes. Um, and then the implementation and enforcement section is really like, if your rights are being violated, who can you talk to? Who can you report that to? And then who do the facilities need to report their training to? So on the back, we set up a precedent for where these Bills of Rights have passed in the past. And what their key components have been, just to show that like this is not a new idea. This is something that has been going on. It's kind of slowly making its way across the US. And then we have this expected impact section. So we included a story, as well as like the benefits that come with passing a long-term care Bill of Rights that really focuses on the benefits of the cultural sensitivity training. Which we interviewed someone for this, and that was a really interesting thing. I also interviewed someone separately, and their stuff didn't make it into this one pager, but it was a really cool experience to be doing that, like community one-on-one engagement with people. And then, yeah, we finally end with like a call to action. So this one is the back for constituents. So we ask people to contact their elected officials to support this, to share the press release that Sage is going to put out, and to sign up for updates, and join the coalition. And then we also have a second back page, which I guess is, here we go. Okay, is here, where the only difference is this call to action section. But we ask people, this one's aimed toward politicians and policymakers. So our call to action focuses on co-sponsoring or signing onto the bill, calling in colleagues who they think might be allies on this, and to publicly elevate and talk about the issue, to try and get this passed. So that's my policy product. It's been a really interesting process. This has been something that I've been working on throughout my time at Practicum, and it's had a really interesting community engagement piece as well. So yeah, I think that's about everything that I have to say. I appreciate your comments, Gary. I totally agree. It is super, super needed, especially in current times, with everything going on. So, yeah.
Thank you, Sarah. That was really great. And you can definitely see how like your passion shines through in your presentation. I also really liked how you adapted your policy product to different audiences. So thank you. And next we have Eamon Fisha presenting on Coldwater Creek Cancer Cluster.
Hi everyone, good morning. I'll try to share my screen now. Actually, good afternoon. Um, Hope that's visible. I was going to do a presentation on my white paper on the concert cluster of Coldwater Creek, but since we have limited time, I turned it into a presentation and hopefully it's much more easily digestible. So essentially, the Coldwater Creek in northern St. Louis County was contaminated and is still contaminated with radioactive waste from the Manhattan Project era. And as we've known, radioactive substances have been linked to myriads of cancers, and they're very dangerous to the public health. And what we've observed, according to our lists, was that federal acknowledgement and recommendations have been really slow and lagging. And um, grassroots level communities have remained inadequately warned. Health monitoring has not been done properly, and when we talk about compensation, that's also something that's really indicative of having a conversation about when it comes to these things, because the damage has already been done, and this plays a very crucial, important area in my work. I'm interested in cancer epidemiology, and I have a background in environmental health, and that's something that I've really been trying to work on with regards to lower income countries and having these sort of uh, um, payback or compensations be attributed to in a way it's transitional justice. If communities are supposed to progress in the future, these things cannot be overlooked. So the scope of the problem is contamination still persists in the soil and the water system near homes and schools. The Agency for Toxic Substances and Disease Registry has confirmed in 2019 there is an elevated cancer risk, and in January 2024, warning signs have been seen for the first time. Again, there's no federal surveillance or health support or education campaigns going around in the county, and environmental justice issue affects this under deserved communities. And this is very pertinent to Noor's previous policy brief on, water flooding and climate induced worsening of these things, because this can relate to other areas outside of that area specifically, because flooding might worsen the contamination spread. And so the gaps I've analyzed are that for the U.S. Army Corps of Engineering, the formerly utilized sites remedial action program, it's a very long name. The FUSRAP, as they call it, focuses on cleanup and not specifically on public health. So it's not given a very good focus. RECA, the Radiation Exposure Compensation Act, does not cover the Missouri Coldwater Creek residents, and specifically, that's where it's needed the most in our county, in our state, and no targeted cancer registry or health screenings have been developed for those residents, and uh, these grassroots community level leaders have been filling this void, and it's not sustainable in terms of what we're going to experience in the future. So here are the policy recommendations: is to establish a health surveillance and cancer registry within the community, to expand the RECA, to include Cold Water Creek zip codes, to launch community-based risk communication campaigns, to expand on and accelerate the FUSRAP's remediation compensation, and also develop climate resilient infrastructures to, not have an overspill of these risks to other zip codes. So on surveillance and cancer registries, there's longitudinal tracking via Missouri's cancer registry. So free screenings could be provided. We could partner up with the health services, and Missouri can partner up with CDC to be better at developing these strategies. And the estimated cost would be around 21.5 million over 5 years, according to other similar types of interventions that have been implemented in other places in the country. And on recommendation 2, the other zip codes that need to be included in RECA expansion are these ones that are listed, and we need to have advocacy through the Missouri delegation, which would be a similar costing amount as this. We also recommend risk communication and health education campaigns for health workers with multilingual materials. As we know, Missouri is diverse in that area specifically. School and neighborhood workshops, which would estimate around this, and it could be funded by the Human Health Services Agency. And we could also speed up the cleanup. It's very, as I said, it's very lagged and it's a very slow process. And the damage is already been done, and it's continually going to be done to the rising population in those areas. And also climate resilient infrastructures. These are needed, and these are essentially what public health should be focusing on. Although the damage has been done, other parts of the county could be at a greater risk. So to conclude, this is a public health emergency decades in the making, and it's very dangerous and detrimental to the society around and within. A comprehensive response must be included. Compensation, communication, remediation, and infrastructure should be worked on. The federal, state, and community collaboration is key, protecting health and advancing the environmental justice, or might I say injustice, that's been committed. Here were my references, and thank you very much.
Thank you so much. That was very interesting, and also I appreciated the thoroughness of your recommendations. Thank you. So next we have a presentation entitled October 1st, 2024 from 9 a.m. to 1 p.m. Presented by Dagi Mawi Mohammed.
In submitting the presentation title, because my title was about degrowth and its relationship with mental health, more specifically the need for degrowth in the US. Can you guys see my screen?
Yes.
Okay. So I'm not gonna take a lot of time. This is probably gonna be a 5-minute overview of my policy brief. I would like to start from the statement of the problem. For a very long time, there has been a very high emphasis on growth and constant economic output. Although that provided a lot of benefit to society, including advanced technology in healthcare, more medications, and longer life expectancy, and generally made our day-to-day life easier. That also led to unrelenting, constant striving for an output which in turn resulted in several mental health consequences, including stress, anxiety, and burnout. The other point that I noted in the policy brief is how this constant striving for output is not leading to alleviation of poverty in a wider scale. As you can see, between 1995 and 2021, economic growth was unequally distributed, and the wealthiest 1% captured 38% of the total wealth growth, while the bottom 50% accumulated only 2.3%. And from the American Psychologists Association research, a survey found that 77% of the workers reported at least some form of mental illness or stress within a month, while 57% experienced some form of negative emotional exhaustion or low productivity or irritability within like 1 month's time frame. This came from, as I mentioned earlier, from a long-standing constant push for growth and output that doesn't take other aspects of life and community into consideration. In addition to the mental health consequence, it's also leading to environmental degradations and other issues, as mentioned here. Even if the Americans are like 4.2% of the world population, they have a very there is a deficit in biocapacity as reported by Global Footprint Network. These are my policy recommendations. The first one is to implement alternate indicators to GDP that include other metrics that take, if as stated by Meadows, changing indicators can be one of the most powerful and at the same time the easiest way to making a systems change, because if we're measuring the wrong things, we're not gonna change anything. We should focus on making our parameters holistic as well. The second policy option is to introduce a national reduced work time limit bill for enhanced workforce well-being. This means Congress must introduce a policy that mandates shorter work weeks to mitigate the mental health toll of overworking and improved worker health. In addition, the third policy option I recommend is to decouple well-being from paid employment. That way, the need and the demand for productivity doesn't lead to the mentioned mental health challenge, such as stress, anxiety, and different other mental health outcomes. This was already proposed and other countries are trying to implement it, an unconditional basic income that would provide economic security, allowing individuals to prioritize well-being over excessive labor. To finalize, these are my recommendations. To shift towards a well-being centered economic model, policymakers should prioritize a combination of the above policies, such as developing and adopting alternate economic indicators, legislating a reduced work week, and also exploring the feasibility of unconditional basic income. These are my references, and thank you. Let me know if you guys have any questions. I'm going to stop sharing.
Thank you for sharing and explaining such an interesting and important public health issue. So now we're going to move on to our next presenter, which is Bethel Alemayehu. And the presentation will be on toxic divide, how air pollution and environmental racism threaten public health in St. Louis.
Bethel is joining us now as a presenter.
Okay. Can you all see my screen?
We can.
Uh, how about now?
Yeah, we could see it now.
Okay. Okay, so my good afternoon, everyone. I'm gonna present on the air pollution and environmental racism, specifically on St. Louis. It's a critical issue because it affects like thousands of people in St. Louis, and this not only jeopardizes the health of like residents, but also it disproportionately affects marginalized communities, particularly communities of color. So, and there have been some policies directly focusing on these, but not really having the effect that it actually needs. So when we talk about the problem, right now, I think St. Louis is the 13th worst air pollution, depending on the ozone by the American Lung Association, and also I think 51st worst on the short term PM 2.5. So it has like one of the most polluted cities in the US, and it's no surprise that like marginalized communities are like bearing the brunt of this burden. So community of color, especially in areas those historically marked by redlining, they are living in high pollution zones, some specifically on industrial areas, some in highways, things like that. So these people, for example, children living in those areas are affected by having like a lot of health outcomes like asthma, having high asthma rates, nearly like double the national average. And this is like the direct result of discriminatory housing policies that used to be that continue to plague these neighborhoods. So the pollution from industrial facilities and also the poor urban planning that doesn't incorporate the community's needs. This has like a deadly impact on the health of these residents. So when it comes to the health impacts, this map shows like how the previous redlining and also if the neighborhood is desirable or not. That shows that, and exposures like to air pollution it has been linked to a range of like health problems, including asthma, cardiovascular diseases, and also even cancer. So in St. Louis, the people living in most polluted neighborhoods, many of whom are Black or Latino, they are suffering from these chronic conditions at a much higher rate than their wealthier and also predominantly white counterparts. So what we see from this is like there are some policy failures that failed those neighborhoods. So despite the clear like evidence, the air quality regulations in St. Louis, like they remain weak, and reinforcement is often like non-existent in those especially non-existent in those marginalized areas, while affluent neighborhoods are like we can see some improvement in air quality, and low-income communities of color still continue to suffer. So air quality monitoring is primarily focused on wealthier, like predominantly white areas, and this leaves the most affected communities underrepresented. So without accurate data from like these high-risk areas, it's nearly impossible to advocate for the resources and policies necessary to improve the situation. So what I, from previous literatures and also from what is happening, what I recommend as a policy is first, we must expand the air quality monitorings to include areas that have been historically left out, particularly in communities that have been affected by redlining. With better data, we can better understand the extent of the pollution and what to take, like the actions, the appropriate actions to take. And second is like stricter emissions regulation that needs to be like reinforced. So we must ensure that like industries to reduce their pollutants and also like holding them accountable for the damage they cause. And also like zoning laws should be revised to prevent like further industrial development in those specifically affected areas. And thirdly, we need to invest in green infrastructures. That way we can help absorb the pollutants and improve the air quality. And finally, we must prioritize environmental justice in urban planning so that we can no longer allow vulnerable communities to be disproportionately exposed to harmful pollutants. That's all I have for today.
Thank you so much for presenting. I really liked all the visualizations and your explanations of everything. So next is our final presentation called Policy Proposal on Effective Food Safety, Security, and Healthy Nutrition Practices in India, presented by Vishnu Vardhan Thotakura.
Hello, this is Vishnu. Good afternoon, everyone. Let me share my screen. Can you see it? Okay, so it's basically a poster that I would say like it's about a policy proposal on effective food safety, security, and healthy nutrition practices in India. So let us see what's the stake actually is. The stats, what are they saying here? You see like 60% increase in foodborne diseases in India, mostly due to diarrhea. It is projected to be 60% increase in 2030 in the younger children being more vulnerable. And food security is concerned, like it seems like a 111th place, like India scored 111th place out of 125 in the global hunger index. And almost 1/3 of food produced in India get wasted or spoiled before even it's eaten. So it's a big problem, right? And the nutrition, as far as it is concerned, like there is a concept called, terminology called zero food children. It is like where the those like between 6 to 23 months old who did not consume any food in last 24 hours. So that stats is also like in that like third highest prevalent country is India among other 92 other low and middle income countries. So there is like huge problem around this food going on, like if whether it's a safety or security of the nutrition. So what if we can address them through global solutions? I've tried to look around literature like about the policies or acts that other countries are doing around this food problem, like food security and safety and nutrition. So about this food safety, I've come across this regulation from European Union. It integrates its rapid system for food and feed with trade and control and export system. It's basically a good communication system, and it alerts the systems within like so quick time that the contaminants or like the food prone, illnesses can be taken care of. So these are 2 points like which India can adapt, I think. So India has something called FSSAI, although it is like a food safety and standards authority of India. They could use this digital tools effectively incorporating these regulations which European unions are following. And there is also something called the handling training techniques. Like there is a program from WHO for specific to India. It's called FOSTAC. But the essence of making this familiar to everyone, that's the real high importance here. Because we see a lot of street vendors and a lot of local businesses not being aware of how to handle food and the hygiene and all. So I think more emphasis should be made on that. About the food security, you see that in the France, there is a law that in 2016 which imposed that like large supermarkets they should never throw any unconsumed or waste food materials. Like they should donate it to food banks and charities. And India has something called National Food Security Act. I think it should be considering like acts around the world like these to incorporate and update or revise. Yeah. So like to imply that the food is no longer like being wasted, despite like you see the hunger going out in stats there. So it's a good way to revise the acts. And about the nutrition education, this is very interesting that Japan, it has schools with a program called Shokuyiku, which means like nutrition about food, and they're being told about the children being told about the food origin, the types of food, and the culture and nativity of food, and the quality of food. So despite of like the India has like I mean many countries have these midday meal schemes like where they'll be giving tokens or giving some cash amount so that their food will be compensated, like food will be taken care of. But I think this one actually emphasizes on the nutrition education, like how important or what ingredients do you take and how is it playing important role in your future. So I think there is a PM portion scheme now going on in India. I think that should adapt such kind of curriculum where dietitians work with school teachers to help this integrated in the curriculum. So what does it take to achieve this? Actually, a lot of things are focused over the involvement of policymakers, right? So also administrators like the schools or like the organizations like supermarkets and also the communities like who can actively participate, who can share the leftovers or like being responsible about nutrition and healthy diet. So this is actually the decreasing order, or like however you see these three must be involved, like policymakers, in administrators and communities, and to address the solutions to provide effective and better way of healthy living. Yeah, that's my poster about project. Hope you like it, and I would happy to take any questions you have.
Thank you, Vishnu. Your poster is great and very visually appealing. And I also loved how you drew upon other countries' policies about food security and safety. Okay, so that concludes our presenting portion of the showcase. Thank you to all the presenters on your hard work and also your willingness to share what you've been working on this semester. So if you have any questions for our presenters, please put them in the chat. Yeah.
Well, I think we can give just a minute to see if there are any questions, but I just wanted to say congratulations and great work to all of our presenters today. This is really wonderful to get to see sort of the culminating process and product of the Graduate Policy Scholars Program, and just to hear all the diverse topics and interests of our students. It's really been an educational hour for me. I know I've learned a lot. And we do have a question in the chat. So I can read it off, Despina. It's from Gary. Our first question is, how would you begin to get your policies implemented and where would you start? So I think this is a question for the whole group.
Yeah, I'm happy to start. For my policy, we are trying to get it implemented. And one of the places that we started was coalition building. So like coming together with people who are affected by this issue, and people who are involved in like who would, I guess, be the ones to carry out the pieces involved. So like the service providers, and then more on like the political side, once we got our coalition started, we um contacted a legislator, a representative and a senator on the state level to be the sponsors of the bill and to like help us with bill writing and like the inner politics of kind of that state level where we're trying to get it passed. So I would say that's where we started.
So as far as my study is concerned, like I addressed like there are 2 or 3 boards that I mentioned. One is like Food Security Safety Authority of India, and the other one is PM Portion Scheme, which is like nationally organized scheme. So I think it's better to reach out with evidences like I mean, this is like a short brief where they can get info from 2 minutes in 2 minutes, but I think we can give elaborated report on that if they are free, and we actually should be focusing on policymakers actually, so that they'll be addressing these solutions and referring them in the assembly, like we call that like parliament, or yeah, in the open house where every members of the assembly can like discuss upon that. And actually there is no major like counter arguments, we say, right, like in the policy that why should it be included, or what's the hurdle of this if we implement it. We should also look forward to that, like if they ask any argument questions. I don't see them as of now, like it is feasible. So yeah.
Thank you for sharing your responses and for your question, Gary. If anyone else has any questions, feel free to post them in the chat. And yes, congratulations to everyone and all the scholars on the GPS program. It's been a great semester, and thank you to Stephanie for helping organize this event.
Great. Thank you everyone for joining. I will share a quick slide with a link to our recording that we will also be sharing later. So if you want to watch our previous showcases or catch the recording of this session, that will be shared on our YouTube channel. And we will have that up in the next day or so at the Brown School Open Classroom recordings. Thank you all. Thank you to our student planning committee. You all did a great job pulling this together. It was great to hear from all of you.